The alarms have been ringing for months. We knew Zika was coming, but instead of being proactive and prepared for what was about to hit our shores, Republican leaders in Congress chose to ignore the warning signs and send Congress on vacation without acting. Democrats fought Republican opposition to pass the president's request for $1.9 billion to battle Zika. In May, the Senate approved, in an effort to reach a bipartisan agreement, by a vote of 89 to 8. 89 to 8. Those are not votes we get very often in the Senate these days. A bipartisan compromise for less than the president's request, but still $1.1 billion. But it was derailed in the House of Representatives by Republicans who insisted on adding a poison pill amendment to a clean bill that would have prohibited Planned Parenthood and other family planning clinics from receiving Zika funds. Now, it's counterproductive for Republicans to deny health options to women in high-risk areas, since Zika is not only spread sexually, but infects the most damage to fetuses. Every major health organization, from the Centers for Disease Control and Prevention, the World Health Organization, to the American Congress of Obstetricians and Gynecologists, has recommended that the best course of action is to increase access to contraception and family planning services to decrease transmission of the virus. So I've called on Senate Majority Leader McConnell and House Speaker Ryan to immediately call Congress back into session, cancel the remainder of the congressional recess if it's necessary, and get back to work to help the American public, especially women and families, in the face of a potential crisis. We can't afford to wait any longer. It's time for Washington to get back to work and to respond without partisanship or political considerations to what is a national emergency. You know, I hear many of my colleagues talk about that the defense of the nation is its primary priority. And yes, it is. But there are many ways in which we can discuss defending the nation and its people. We can discuss that from foreign entities that we wish to protect ourselves from ISIS. We can talk about that in a domestic context. But at the end of the day, protecting your people from an insidious virus that ultimately can affect the next generation that is being born is, in fact, protecting the public. And it is, in my mind, not acceptable to play politics with a national emergency. We can have all the debates in the world about family planning and Planned Parenthood and all of the entities that may be engaged, but you don't do that in the midst of an emergency. You respond to the emergency. We are delaying the possibilities of a vaccine being achieved here. We are delaying the possibilities of doing what Edison is doing more pervasively across our state and across the country. We need to pass the necessary funding and be prepared at the end of the day.